Hi, Dr. Stone. Good. I'm doing real good. Yeah.
During the pandemic, heart doctors at Mercy Hospital St. Louis say patients should not feel like they have to wait to meet with a doctor. Virtual visits can get heart patients seen and heard.
The video visit's been really helpful for patients because we're trying to expedite their time in the hospital, especially in these COVID times. We don't want them to be in the hospital for longer than they have to.
And there may be an outpatient procedure without a hospital stay that would be a life changer.
So because of COVID, it kind of initiated this approach.
During the first year of the pandemic, Mercy Hospital St. Louis tried something new. That's when the Transcatheter Aortic Valve Replacement surgery, or TAVR, became a procedure that no longer required an overnight hospital stay, as long as a patient qualified.
If they do that, it's very convenient for them to then not have to stay in the hospital and go home and sleep in their own bed.
Just like his patient, Dick Bonin. Bonin became the first TAVR same-day discharge patient in the St. Louis area.
Using a stented valve that's mounted on a balloon, and it's basically to treat patients with a narrowed aortic valve.
After Bonin's procedure, he was back to the outdoor activities he loves. He would be the first person to tell anyone, the heart needs attention.
I should have had this procedure a long time ago. I was out doing this deck, but I couldn't do very much. I'd come out and work about 5-10 minutes, and I'd have to go in and take a rest. My wife and I walk, and there's a hill over here. We call it Cardiac Hill. And I had to stop going about halfway up the hill because I was getting a tightness in the chest. And I told the doc about that. That's when he said, yeah, you're going in for a stress test. He said I could just kill over any day.
Normally, the heart procedure would have been a big deal for him, with a hospital stay of 30 to 34 hours. Motivated by the pandemic, Bonin is now among many patients having positive outcomes with a same-day discharge. He went in at 6 a.m. and was home by 6 p.m. The procedure took 90 minutes. Now Bonin feels stronger and healthier.
I didn't think I was sick. I didn't think I had a problem until, especially after the procedure. So I'm lifting these boards right now and replacing this deck. I feel 100% better, sleeping better. I feel like I've gained an extra 10 years.
This is why Mercy encourages patients to try virtual visits and not to wait to get needed care.
Any new issues or concerns?
Mercy just announced it was awarded a $2.2 million grant from the Federal Communications Commission to expand virtual care and upgrade telehealth services in Missouri, Arkansas, and Oklahoma. Mercy says this will help many areas of medicine supporting patient care, and says it promotes social distancing by serving high-risk and vulnerable patients from their home before and after a procedure.
Things that the patients get before they go home is a heart monitor anyway, so we're monitoring them from afar or remotely. With the video visits, the following day or the day after they're discharged, we do a follow-up visit to make sure that everything is going okay. We can actually inspect them. We can actually even have them, show us their access sites. It's a lot more convenient for patients so that they don't actually have to physically be here, especially in these times. But moving forward, we will use this as a tool because a lot of our patients are coming from elsewhere, meaning that they're coming from afar, so it prevents another visit where they actually have to drive in and then drive back home.